guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering young to middle adulthood. If you haven't done so already, guys, please don't forget to like and subscribe below. Make sure you press that notification button so every time a new video is released, you'll be notified. So guys, without any further ado, let's get started. First question. A client thinks she might be pregnant. Which first trimester physiological changes would most likely indicate this? A, amenorrhea and nausea. B, Braxton Hicks contractions. C, increased urinary frequency. Or D, edematous ankles and dyspnea. And I'll give you a moment to think of your answer. And the correct answer, guys, is 1, or A, amenorrhea and nausea, right? The woman misses her period, she starts feeling nauseous, she gets car sick, she starts vomiting. Those are usually the first indications that she says, whoa, maybe I'm pregnant. Maybe I should go ahead and get a pregnancy test. Let's see what the HCG says, right? So we are more likely to see the amenorrhea, obviously, and the nausea, the vomiting, and all that during the first trimester of pregnancy. So let's look at our other choices. You have 2, Braxton Hicks contractions. Are Braxton Hicks, are those true contractions? No, right? Those are the fake contractions. So this we normally see in the second trimester of pregnancy. And then choice 3 and 4, the increased urinary frequency, the edematous ankles and dyspnea, we normally see that in the third trimester of pregnancy. So the reason the mom has the polyuria, she always feels like she has to go urinate, is because that baby, the fetus, has gotten so large and the fetus is pressing down on the bladder, so she has to keep going. And the edematous ankles and the dyspnea. The edematous ankles, this comes from the huge influx of fluid that mom is holding on due to the baby. So her ankles get edematous. And then the dyspnea, that fetus is lying right there on the diaphragm, right? So that diaphragm is pushing up on the lungs and it's hard for mom to catch her breath. Sometimes she gets dyspnea. We see that in the third trimester of pregnancy. But what we see in the first, like I said, the amenorrhea and the nausea. Next question. To determine how the client, who is a single parent of 3 children, will be able to cope with the current pregnancy, the nurse should ask the client, 1, have you ever been married? 2, where do you currently work? 3, has anyone ever taught you about contraception? Or 4, who do you have for support during this pregnancy? And the correct answer, guys, is 4. Who do you have for support during this pregnancy? 1, have you ever been married? 2, where do you currently work? The answer to those questions will not tell us how much support the woman has, right? That's not going to answer the question. Choice 3, has anyone ever taught you about contraception? I think it's too late for that. She's already pregnant, right? And even if she does answer it, that does not tell us how much support that woman may possibly have during this current pregnancy. But choice 4, who do you have for support, right? That will let us know how well she'll be able to cope. Is her mother there to help her? Her father, the father of the child, sisters, brothers, cousins. So that's the one that's most likely to let us know how she's going to be able to cope with this current pregnancy by knowing who her support system is, who she has available to help her. Individuals at the young adult point in their lives are generally expected to, according to developmental patterns, 1, continue physical growth, 2, experience severe illnesses, 3, ignore physical symptoms, or 4, seek frequent medical care. And the correct answer is 3, ignore physical symptoms. Why? The young adult, what are they preoccupied with right now? Their careers, right? Either they're still in college, about to graduate, or in trade school, but trade school or college or whatever that training is training for what? Their careers. That's what they're focused on, right? Their careers. So at this age, they tend to ignore physical symptoms, right? because they say, oh, it's just nothing, I'll get better. They actually tend to delay care. They tend to delay going to see their physician because they're so career and goal oriented. Let's look at our other choices. You have choice 1, continue physical growth. That's for children. Children, their bones are still growing, right? And choice 2 and 4, experience severe illnesses, seek frequent medical care. We tend to see that in the older adult, because the older that you get, it's like wear and tear of the body, right? Like a car, wear and tear of the body. So the older that the patient gets, the more physical illnesses or diseases or disorders that they might experience, and they are more likely to go seek healthcare because they've gone from young adult where your career focused to older adult where they've had their career. They've raised their children. The only thing they have now is their health, right? And so they're going to try to protect it at all, by all means, and they're more likely to go see the doctor and not the young adult. A nurse is preparing an education program on safety for a young adult group. Based on the major cause of mortality and morbidity of this group, the nurse should focus on 1, birth control, 2, automobile safety, 3, occupational hazards, or 4, prevention of heart disease. And the correct answer is 2, guys, automobile safety. So when it comes to the young adult, the number 1 cause of death for young adults is violence. Okay, that's the number 1 cause. So either violence towards self, like suicide, they kill themselves, they shoot themselves, right? Or someone committed violence against them, right? And very high on that list, I want to say second, but I don't want to lie to you because I'm not sure, but I know if it's not second, it's third, okay? Very high on that list. Right after violence is automobile safety, okay? Car accidents, because they're young. They don't have a care in the world, right? And then you remember the young adult, another concern of young adult is what? Partying. What comes with the partying? The alcohol. Okay, so for this question, when it comes to safety, you definitely want to talk about, automobile safety. Okay, because automobile safety and violence are the biggest causes of death in this age group. So let's talk about our other choices. Choice number 1, birth control. Birth control is a source of stress for the young adult. That's definitely something you want to talk to the young adult about, because obviously if they're young adults, they're in that age group where they may procreate, and you want to make sure that they're ready, and that's the time that they want to have a child. But not so much for when it comes to safety. That's number 1. And number 2, like I said, when it comes to safety, high on that list is going to be violence, specifically with a gun, or MVAs, motor vehicle accidents. Choice 3, occupational hazards, and choice 4, prevention of heart disease. Those are not the leading cause of death among young adults. So yes, they can cause death, but they're not the leading cause of death among young adults. A nurse is working in the health office at a local college where most of the students are young adults. Being aware of the major concerns for this age group, the nurse includes assessment of these clients: 1, current marital history, status; 2, lifestyle and leisure activities; 3, experience with chronic diseases; or 4, history of childhood accidents. And the correct answer is 2, lifestyle and leisure activities. Remember, we're talking about the young adults. So you want to find out, are you smoking alcohol? Are you smoking alcohol? Are you smoking tobacco or marijuana? Are you drinking alcohol? Are you taking any illicit drugs? Are you exercising? Are you eating healthy? Are you having plenty of fiber and diet and fluids, right? What is their lifestyle like? What do they do for fun? What are their leisure activities? That's what you want to ask for this age group, because remember what I told you. The biggest cause of death in this age group is violence and what? Motor vehicle accidents. So let's look at our other choices. 1, current marital history. That really, them being married or not, that tells us nothing about their risks for being injured for this age group. 3, experience with chronic diseases. That's more appropriate question to ask the middle and older adult, not really the young adult, because the young adults really don't tend to have chronic illnesses such as the COPD, asthma, hypercholesterol, heart disease, okay? And then choice 4, history of childhood accidents. Again, that does not tell us the risk factors for the young adult as far as safety is concerned. So the correct answer is lifestyle and leisure, because like I said, we want to know, are you smoking? Are you drinking? Are you taking any illicit drugs? As an individual enters middle adulthood, health problems generally become more prevalent. The middle adult may be influenced by chronic illnesses that result in 1, decreased healthcare tasks, 2, reinforcement of family roles, 3, changed sexual behavior habits, or 4, improvement of family relationships. And the correct answer, guys, is 3, change sexual behavior habits. Okay, so now we're dealing with the patient in middle adulthood that has these chronic illnesses. How is that going to change their lives? Change sexual habits. They've got these chronic illnesses. Maybe they have polypharmacy. They're taking all these different medications, and these interactions are decreasing their libido. They're not wanting to have sex as often. Or they've got these chronic illnesses and they're sick all the time. They don't want to have sex as often. Or they have these chronic illnesses such as hypertension, and they're taking medications for the hypertension, and they're getting what? Sexual dysfunction. Or they have all these chronic illnesses and they're tired all the time, fatigue, right? So there's so many different reasons why patients with these chronic illnesses, especially in middle and adulthood, their sexual patterns and behavior is going to change. So let's look at our other choices. 1, decreased health tasks. No. That patient that has chronic illnesses, their health tasks are going to be increased. They're going to have to do more to stay healthy because they've got more illnesses that they're dealing with. Choice 2, reinforcement of family roles. We're going to see a change in family roles. So if dad was the primary breadwinner, right? But now he's got all of these chronic conditions and he can't work full time anymore. Maybe he can only work part time. Maybe he can only work per diem. Maybe he can't work at all. So he's gone from being the breadwinner to now being a dependent, right? So, or same thing with mom. So number 2 is absolutely false. Having chronic illnesses is not going to reinforce the family roles. It's going to change the family role, right? Or the husband is now caretaker for the wife. Choice 4, improvement of family relationships. No. Normally, when there's chronic illnesses involved, family relationships tend to be under stress. They tend to deteriorate, right? Because chronic illnesses come with what? Stress. Financial stress, emotional stress. So number 4 is wrong as well. The correct answer is number 3. The nurse is performing a physical examination on a 58-year-old adult client. The nurse will most likely find that the client of this age is experiencing which one of the following physiological changes related to normal aging? 1, palpable thyroid lobes. 2, decreased skin turgor. 3, reduced pupillary reaction. Or 4, increased range of joint motion. And the correct answer is 2, decreased skin turgor. So when we see the middle and older adults, what happens? Their skin starts to thin, right? And not only does it start to thin, the skin turgor starts to decrease. So remember, skin turgor is supposed to be less than 300, right? It's not supposed to tent, but as they get older, we'll see the skin turgor starts decrease. I'm sorry, guys. I told you it increases. The skin turgor starts to decrease. What happens is when you pinch that skin, instead of going down automatically, what do? We might see a little bit of tenting, right? Because of the decrease of skin turgor. Let's look at our other choices. You have 1, palpable thyroid lobes. Those lobes are not supposed to be palpable at any age, okay? If they're palpable, that signifies a disease process going on, and that needs to be investigated further. 3, reduced pupillary reaction. That's, again, is not expected with any age group, okay? If we see decreased pupillary reaction, that's a problem that signifies possible neurological damage. That needs to be investigated further. And then 4, increased range of joint motion. No, as you get older, we're going to see decreased range of joint motion, right? I used to be able to run around all day. But now, sometimes if I'm sitting too long, just the fact that I get up to stand, I'm like, oh, my back, right? It's wear and tear of the body. So 4 is false. The only correct answer is 2, decreased skin turgor. And why? Because their skin tends to get drier. It tends to get thinner. And because of that, I don't want to say dehydration because that is a diagnosis, but for lack of a better word, I'm just going to say dehydration. We tend to see that skin turgor decreases, okay? The nurse is alert to stressors that may have an influence on the young adult. One example of a common stressor for this age group is 1, occupational pursuits, 2, health-related matters, 3, coping with cognitive changes, or 4, caring for the older adult parent. Now, you all should get this right because I've talked about this ad nauseum, right? The correct answer is 1, occupational pursuits. When it comes to the young adult, they're focused on their career, on whatever it is that they want to be. They want to be the best at it. They're focused on that promotion, right? So choice 2, 3, and 4, health-related matters, coping with cognitive changes, caring for the older parent. We see that more in the older, middle, and older adult, not in the young adult. Because young adults are less likely to experience serious illness, which of the following nursing interventions is most effective in determining risk for illness in this age group? 1, health screening. 2, personal lifestyle assessment. 3, full body system assessment. Or 4, cardiopulmonary focal assessment. And the correct answer is 2, personal lifestyle assessment. Again, do you smoke alcohol? Why do I keep saying smoke alcohol? Do you smoke tobacco? Do you smoke marijuana? Do you take any illicit drugs? Do you drink alcohol? Right? You're going to ask about their personal lifestyle assessment. Are you having sex with more than one partner? Are you using protection? During a routine physical assessment, a 27-year-old client acknowledges the suspension of his driver's license because of an arrest for driving under the influence of alcohol. This admission should prompt the nurse to discuss which of the following in detail with the client. 1, use of illegal drugs. 2, history of depression. 3, unprotected sexual experiences. Or 4, tendency towards violent behavior. And the correct answer is 1, use of illegal drugs. And guys, you want to assess the use of illegal drugs whenever you have a client that has also gotten a DUI, have gotten arrested for spousal abuse, has gotten arrested for child abuse, that's gotten arrested for disorderly conduct. Any of those, you're going to want to ask more questions and find if there's any illicit drug use that's involved. Choice 2, 3, and 4, these are things you want to ask about, but they're not as high of a risk factor as illegal drugs or illicit drugs are. Which of the following lifestyle choices poses the greatest risk for illness to the young adult? 1, alcohol and tobacco use. 2, ignoring seatbelt and helmet laws. 3, unprotected sex with multiple partners. Or 4, poor nutrition and lack of structured exercise. By the way, guys, all of these are possible risk factors that we see in the young adult. but the question is which one is the greatest. So out of these 4 risk factors, which they all are risk factors, which one is the biggest? And the correct answer is that 1, the alcohol and tobacco use. That is the greatest risk factor to chronic illness, to the patient getting cancer from all that smoking, to the patient getting encephalopathy that's caused by liver damage, right? So, excuse me, that's why number 1 is the correct answer, because what they're asking about is not the biggest cause of death in the young adult group, is the biggest cause of chronic illness, and it's alcohol and smoking. Which of the following client responses shows the best understanding regarding the management of risk factors for chronic illness among young adults? 1, unprotected sex is just plain dangerous. 2, everyone riding in my car wears a seatbelt. 3, I'm a vegetarian, but I eat non-animal protein. 4, I've never smoked and I drink only occasionally. Now, I hope you guys all chose 4. I never smoked and I drink only occasionally. Because if you go back to the question, they're asking about risk factors for what? Chronic illness, not death. If they asked about risk factors for death among the young adults, 2 would have been our answer. Everyone in my car is riding with a seatbelt, right? But no, that's not what they're asking about. They're asking about chronic illness. And that, guys, that's why 1 or 2 words in the question will completely change the question. So our correct answer is 4, I've never smoked and I drink occasionally. Because the biggest risk factor for chronic illnesses among young adults is smoking and drinking. Which leads us to the next question. Everybody should get this right. Which of the following lifestyle choices poses the greatest risk factor for chronic illness to the young adult? Guys, have I drilled this into your brain yet? 1, alcohol and tobacco use. 2, ignoring seatbelt and helmet laws. 3, unprotected sex with multiple partners. Or 4, poor nutrition, lack of structured exercise. I feel like I did this question already, but we'll do it again. And the correct answer is 1, alcohol and tobacco use. This is the number 1 cause of death, chronic illness among young adults. Which of the following nursing assessment questions is best directed towards determining the presence of a normal physiological change experienced by a middle-aged client? 1, any problems with your teeth or gums. 2, any family history of thyroid problems. 3, do you have a skin moisturizing routine? Or 4, are you having a problem with driving at night? And I'll give you a moment to think of your answer. And the correct answer is 3. Do you have skin moisturizing routine? Remember, the question is for middle adults. And what did I tell you about those middle adults? Their skin tends to be dry. Okay, it thins, it gets dry because of that dehydration. They tend to be dehydrated. So you're going to ask them, do they have a skin moisturizing routine to bring more moisture to the skin? Because remember, they tend to have what? Decreased skin turgor, and that's because of that dryness. Okay, guys, we've already made it to our last question. Which of the following statements concerning health promotion habits made by a young adult best reflects an understanding regarding the primary cause of death and injury among that age group? 1, eating a healthy, low-fat diet is very important to me. 2, AIDS is nothing to mess with, so I always practice safe sex. 3, regardless of what my friends say, I always wear a seatbelt. 4, I enjoy mountain biking, but I always wear the right protection gear. And the correct answer is 3, regardless of what my friends say, I always wear a seatbelt. That's the answer, because this question is asking us about the greatest risk factors for death. Not chronic illness, for death among the young adult. And we know that it's violence and car accidents. So number 3 is our answer. Guys, I hope this video was helpful to you. If you found it helpful, please support me, support my channel by sharing this video, and of course, liking and subscribing below. Go ahead, press that notification button so you'll be notified every time a new video is uploaded, and leave me a message if there's a video that you'd like to see. Guys, thank you so much for sharing this time with me, and I'll see you on the next video.